Hello, everybody. Hi, I'm Dr. Adelsheimer. We're going to get started now. Hopefully everybody can hear me. And I want to thank you first and foremost for coming tonight and joining us on our webinar. And I'm going to be sharing my screen with everybody in a minute, and we can get started. Also, I want to make sure everybody realizes that I will answer all your questions at the end. So if anybody has any questions, you can either write them down, raise your hand, type them in, or we can just talk at the end when we're going to get started. So the first thing I'm going to do is share my screen so people can follow along with today's presentation. So let's get things started here. So again, this is how to avoid surgery by using your own cells, regenerative medical treatments, using your own platelets and stem cells. So again, to introduce myself, my name is Dr. Marc Adelsheimer. I'm got my undergraduate degree from Duke University in 1987, my medical degree from the Medical College of Pennsylvania in 1991. I did my training up in Boston, and I've been working in Pittsburgh now since 1996. I'm board certified in physical medicine and rehabilitation, and also in the subspecialty of pain medicine. And in my spare time, I like to play a little golf. This is our practice. That's me on the left, Dr. Lieber in the middle, and Dr. Sally on the right. Dr. Lieber, all three of us are Pittsburgh natives. All three of us are board certified in physical medicine and rehabilitation. Dr. Lieber and myself have subspecialties in pain medicine, and Dr. Sally in sports medicine. Our locations in the Pittsburgh area are our main office in Pittsburgh or in Fox Chapel. We also have satellite offices in Monroeville, Bridgeville, Washington, and Sewickley. So basically, we can see and evaluate patients from all over the Pittsburgh area. First and foremost, we're a COVID safe zone. Everyone in our office has been immunized, and somebody can feel very safe and comfortable coming to see our physicians and our staff in our practice. So why is everybody here? What are we talking about tonight? Why are you here? I know everyone's looking for options as to how they can avoid surgery, and also how they can learn how to heal their own problems with themselves. So whether it means you want to go out and play golf, you want to play sports, or just be more active with your children and grandchildren, it's all about improving the quality of your life. So this is a little overview of tonight's discussion. First, we're going to talk about Regenexx, which is our company that we're involved with, different options. We're going to talk about interventional orthopedics. We're going to talk about the differences that Regenexx has to provide, especially when comparing to other providers out there. We're talking about who this is for and also different results that we have. So let's first talk about Regenexx. Regenexx is a family of physicians. It was where orthopedic stem cell injections were invented. It was founded in 2005 by Dr. Centeno and Dr. Schultz, who are two physicians that we all know very well because we've known them since before 2005. Every person in the Regenexx network is a physician. There's a national group of providers. There are no physician assistants. There are no chiropractors. There are no nurse practitioners. These are all physicians, board certified MD or DO physicians. Everyone is trained the same way, meaning that every one of the physicians has been trained by Regenexx in how to do the procedures that we perform. That includes prolotherapy, PRP, and stem cells that we're going to be talking more about as we go further into the discussion. Regenexx is not a product, but it's a family of medical procedures that define what we consider a new medical specialty, and that's interventional orthopedics. Regenexx is also not adding on to an existing surgical procedure, but it is a new way of approaching orthopedic problems. So what is the goal of interventional orthopedics? What are we talking about? First and foremost, our goal is to use less invasive procedures to avoid more invasive surgeries. And we do this by letting the body heal itself. Rather than cutting things out, why don't we let the body do what it is intended to do and has a capability of doing, and that is healing itself. So there is good data to suggest that surgical orthopedics will not be the dominant form of orthopedic care in the 21st century. There is excellent data to show that 95% of meniscus surgeries are only removing the needed meniscus spacer, and it actually is causing more harm than good. So not only is it not necessary, it's actually speeding up the onset of arthritis. So people who are undergoing meniscal surgeries are actually causing harm to their body. So when you go to see an orthopedic surgeon and he says, hey, let's do a clean out procedure, you're actually causing harm. So let's stop cleaning things out or cutting things out. And instead, we can inject biologic agents that can help tissues heal. Because of biologics, orthopedics will become mostly injection-based. And this is just a little timeline of kind of where things were, where things are moving to, and really where the future is. What this shows is that by 2030, about 70% of orthopedic treatment will be injection-based, meaning that orthopedic surgery will be significantly less necessary because there are ways to heal things without the use of surgery. Also, when we're talking about Regenexx and doing interventional orthopedics, we're not just blindly sticking needles into joints and hoping we hit the right spot. Most physicians can do blind injections, meaning they just stick a needle in and hope they hit the right spot. About 45% of doctors who have had a little bit of training may be able to have a little better accuracy, but precision-guided interventional orthopedics is only by very select physicians. One's in the Regenexx network and very few other select physicians around the country that have had the advanced training to do precision-guided interventional orthopedics using musculoskeletal ultrasound and using fluoroscopy to help to do these procedures. So we're going to talk about different treatment types that we do here at Regenexx, mostly talking about same-day stem cell procedures and also PRP and platelet lysate procedures. So first, let's talk about platelets and why we use platelets in a lot of our procedures. Platelets are a blood cell, so we find them in blood. So when we're using them, it's pretty easy. All we need to do is draw some blood, and then we can take that blood and spin it down and isolate the platelets. And the platelets themselves contain healing growth factors, and they help to speed up the repair of tissues. They also contain a substance known as serotonin, which helps to calm down pain. And platelets act to attract stem cells and they activate stem cells. So meaning that they're initiating repair responses in the tissues that they're injected in. Oh, let me go back one. So we use platelets in two different fashions. One is PRP, or platelet-rich plasma, which we use when we're injecting joints, tendons, ligaments, cartilage. Here you can concentrate platelets and growth factors are released slowly. We also do a procedure with platelet lysate, meaning that we take those platelets and we lyse them so they will immediately release all their growth factors. And this works much better when we're treating injured nerves. And in our practice, most commonly, it's when we're doing our epidural injections. So instead of putting steroid into the epidural space, we're putting platelet lysate in to a damaged nerve, which can help to heal that nerve. Another good example for platelet lysate is for carpal tunnel syndrome or for other types of nerve problems around the body. Now, most orthopedic practices are doing PRP. However, they're using an inferior product. This next slide shows what standard PRP looks like. And we know this because before we were part of the Regenexx network, that's what our PRP looked like, meaning that it looked bloody. It was red. Whereas at Regenexx, we're able to eliminate all of the red blood cells, and therefore you're injecting pure platelets, which means that you're going to get a better product. What does a better product mean? That you'll get a better outcome. And again, that's what we're striving for. So we can do one shot, not a series of 3 shots, just one shot, so we can improve your outcome, so you can have much quicker and better healing response. So again, not all PRP is the same. Regenexx's PRP is a significantly higher end and better product than you can get at any other provider in the Pittsburgh area. The other cell that we use is a stem cell. And first, I'm going to just talk a little bit about what is a stem cell and why we want to use these. A stem cell is an undifferentiated cell that's held in reserve until replacement or repair is needed. It can turn into many cell types. So the same cell can turn into a cell that can grow new bone. That same cell can turn into a cell that can grow new cartilage. That same cell can turn into a cell that can grow new ligament. That same cell can turn into a cell that can grow new muscle. So again, that's the exciting part about using undifferentiated stem cells, is they turn into cells that can grow new tissue. They also orchestrate repair response when they're placed into damaged areas. So if you take millions of stem cells and place them into a damaged joint, they will orchestrate a repair response within that joint. They will change the biochemistry of the joint from a joint that is degradatory or destroying itself to one that's healthy or repairing itself. And that's what stem cells can do. Stem cells self-renew, so you can continue to use your own stem cells for your entire life. You're not born with a certain number of stem cells, meaning that the stem cells that we will take out to do our procedure, your body will regrow those within 4 to 6 weeks. So the idea that people have that their stem cells may be too old is absolutely untrue, because stem cells are constantly self-renewing. They also provide new blood supply in the areas in which they are injecting. So at Regenexx Pittsburgh, sorry about that. We're discussing adult, which is very important, not embryonic stem cells, because we're not taking these from an embryo and then sticking them into you. And we're discussing autologous, meaning they're from you. These are your stem cells. They will not come from another person, another fetus, or any other source. We also use bone marrow derived stem cells because that's the best, highest quality stem cells. We're talking about mesenchymal stem cells that will come from your bone marrow. Now, we do have adipose derived stem cells, but we generally don't use those because the bone marrow derived stem cells is a significantly better product. So if you decide you want to have a stem cell procedure with our office, it's a 3-step process. And the analogy to these 3 steps is like planting seeds in your garden. So the first appointment is done with prolotherapy. Prolotherapy is a sugar water-based solution that we have on our shelf. So it's not something that we need to get any blood or bone marrow from you. It's something that we have on our shelf that we can extract and inject into the area. And the purpose of the prolotherapy is to till the soil or to make things ripe and rich. So we do this a few days before we do your stem cell injection. The second appointment is 2 parts, and that's what this slide is demonstrating. The first part is we need to get the stem cells, and we get those from your bone marrow. This slide is showing a needle going into the pelvic bone because that's the bone we utilize when we're isolating our stem cells. Now, we've done about 3,000 of these procedures in our practice. I've personally done well over 1,000 of these. I can promise you that it is not a painful procedure to get your stem cells taken from your bone marrow. What you will feel is a pinch and a burn. You'll feel to numb the skin. You may feel a little bit of burning when we numb the bone underneath, but once that bone is numb, you will not feel the needle going into the bone. So anyways, once that needle is in the bone, we take out bone marrow. Bone marrow is where the stem cells live in highest quality, in highest numbers and highest quality. So that's where we want to get your stem cells, because that's the best product or the best place to get stem cells from. Anyways, we'll take your bone marrow to our lab, which is right there in the office. It takes my lab technician about an hour and a half or 2 hours to process your bone marrow so we can isolate just the stem cells. Bone marrow is about 95% other cells and only about 5% stem cells. So we just want that 5%. The other 95% we're going to discard because it isn't going to help you. And then we will re-inject those stem cells under X-ray or ultrasound guidance, depending on what we're doing. But again, just be aware of every needle we stick into you is going to be guided, meaning none of these injections are ever blind. So we're always sure that our needles are in the correct location that we want to be. That's step 2 of a stem cell procedure. And step 3 is done with a few days later, and that's done with PRP or with your own platelets. The reason why we put platelets in after a stem cell procedure is because the platelets act like a fertilizer to the stem cells. As I mentioned earlier, when you use PRP, it can help to activate stem cells so they work better. And that's the 3rd step of a stem cell procedure. So again, the analogy of tilling the soil, planting the seeds, and fertilizing the seeds are the 3 steps involved in a stem cell procedure. So that's basically what you should expect if that's what's being recommended to you. First question is this safe? And the answer to that is yes, it is incredibly safe. And this slide is demonstrating the difference between a Regenexx procedure and surgery. So again, none of these problems have ever happened with a Regenexx procedure, things like death, heart attack, stroke, blood clots, cancer, other things that can happen with surgery. As I mentioned, every needle we stick in you, whether we're doing prolotherapy, PRP, stem cells, bone marrow aspirate, is done guided, meaning we are looking at our needle to make sure we are in the correct location. We use both musculoskeletal ultrasound and we use fluoroscopy to make sure our needles are in the correct location. We have never had an infection with a Regenexx procedure, and that's really important to note because surgery always can lead to infection and can lead to significant problems afterwards. So again, first and foremost, do no harm, and this procedure is very, very safe. So I'm going to go next into what areas of the body we treat primarily with our Regenexx procedures. Again, when people ask me what is it for, I tell them if you have any ache and pain in your body, it's probably something worth looking at. But I'm going to talk about kind of the most, or the highlight, the biggest areas that we treat. So first, we're going to discuss the knee. And the reason why I'm starting with the knee is twofold. Number one is it's the most common area that we treat. And number 2, it is the joint that responds best to stem cells. So, and the number 1 condition we treat is knee osteoarthritis. So even if you have end stage, bone on bone, severe arthritis, I need a knee replacement arthritis, you can come to Regenexx, you can get a stem cell procedure and expect to have a significant improvement. On average, we're seeing about a 66 or 2/3 improvement over baseline. So that isn't just for pain, and more importantly, it's for activity and function. Meaning people who were not walking, who were not exercising, who were not playing golf or biking or hiking or doing other things that they want to do, are now able to enjoy their lives, are able to improve the quality of their lives. And that's, again, the best thing that we can provide with our treatment. We've also looked at age. In fact, we did a 98-year-old gentleman in our practice who did great after his procedure. And we have not had a problem. I mean, we have done several patients in their 90. Age is not a factor. As I mentioned earlier, your body is constantly regenerating its own stem cells. So even if you're 90 years old, it doesn't mean that your stem cells are 90 years old. Your stem cells that we're going to take are probably about 6 to 8 weeks old.
Really?
Weight is also not a factor either. So we have, if you're otherwise healthy, even if you're overweight, even obese, we have done several morbidly obese and obese patients that have had very good outcomes. A lot of our patients have been told by their orthopedic surgeon that they're not a candidate because they're too obese to have a knee replacement. They've had a stem cell procedure and they've never gone on to have their knee replaced. So they've done very well. So again, knee osteoarthritis is a home run when it comes to stem cell procedures. Other conditions that we treat in the knee are meniscal tears or ACL tears. 90% improvement with meniscal tears, as long as that tear isn't catching or locking, which we will be able to tell when we do a comprehensive evaluation of your knee. So again, almost every meniscal tear can be treated successfully. Oftentimes, meniscal tears will respond just to PRP and you don't need to do a stem cell procedure. That would be something that we would discuss with you when you came in. People that have moderate to severe arthritis all have meniscal tearing as part of that. So we treat, when you have severe arthritis, not only the cartilage loss, but also the meniscal tear. And then the third area of the knee that we treat with extreme success are ACL tears. And that's as long as that tear is not greater than 1 centimeter and there's still an intact sheath, which we can tell when we look at your MRI and let you know. That works extremely well, especially for younger athletes. We've done a number of high school and college athletes that have torn their ACLs. They've had a stem cell procedure and they've never gone on to have surgery for a torn ACL. This is just a example of a patient in our practice who had severe knee arthritis. This was Pam. She was a 58-year-old aerobic instructor. She had 4 years of severe knee pain and had grade 4. That's the worst. We grade chondrosis or cartilage loss on a 1 to 4 scale. So when you have grade 4 chondrosis, that's when surgeons are recommending a knee replacement. She received the stem cell procedure on her right knee, and within 3 months, her pain had gone from a 6 to 8 out of 10 to a 1 out of 10. And more importantly, she had returned to the things that she loved, teaching aerobics, doing yoga, doing Pilates. She returned to full duty work and she felt 85 to 90% improvement. And again, this is just a case study, but this is a very common example of someone that we've treated in our practice. These are some MRIs of an ACL tear, pre and post stem cell. Here is the ACL tear that you, I know everyone's not a radiologist, but you can appreciate the difference between the thick black line that you've seen after the stem cell procedure to what you had seen before the stem cell procedure. This ACL is torn. This ACL has now regenerated and now looks healthy and normal. So we're going to move on to the next body part and talk next about the shoulder. Shoulder is probably the second most common part of the body that we treat. And we treat a number of different shoulder conditions. Rotator cuff injuries are an incredibly common sports-related injury and also a common arthritic or degenerative problem that people get later in life. And they are, for the most part, very responsive to regenerative treatment, be it either PRP or stem cells. We even can treat full thickness rotator cuff tears as long as it is less than 1.5 centimeters. And again, that's something that we would be able to tell you when you came in for your evaluation. So if you have a torn rotator cuff, or have rotator cuff tendonitis or a partial tear, you are absolutely a very good candidate for a regenerative procedure. Again, that might be a PRP shot, it might be a stem cell procedure. It really depends on what your MRI shows, what we're able to see on exam, and whether or not you have some other complicating factors like arthritis in the joint. So what we would recommend would be an individual recommendation depending on your condition. Other conditions we treat in the shoulder are a slap lesion or a labral tear. Again, a very common sports injury. They respond very well to PRP and or stem cells, depending on what else is involved. And we also treat a lot of arthritis in the shoulder. So whether that's coming from the main glenohumeral joint, which is the main shoulder joint, or from the acromioclavicular joint, arthritis of the shoulder is very common. And as long as that arthritis isn't end stage, no range of motion, generally they can respond extremely well to a stem cell procedure. We also treat more common tendonitis problems in the shoulders, like bicep tendonitis. I mentioned rotator cuff tendonitis or other tendinopathies in the shoulder region. This is an MRI picture of someone pre and post stem cell with a torn rotator cuff. You can see the big arrow here pointing to where the tear is. That's fluid filling up that spot. And here is after a stem cell procedure, and that rotator cuff is now healed. There's no more fluid. It looks better. There's no more fluid in the joint like there was here. That fluid is all now healed. So that is a significant improvement after a stem cell procedure. Moving on to the hip. Hip, unfortunately, does not respond nearly as well as knees when it comes to severe osteoarthritis. So my purpose tonight is not to tell you that we don't treat hips, because we certainly do. However, if it is end stage, bone on bone, I need a hip replacement, and you're over the age of 55, a stem cell procedure will probably not be very beneficial. However, if it's not end stage and it's more in the mild to moderate stage, hip procedures do extremely well. We also can treat labral tears in the hip. We also can treat tendon problems around the hip. One other condition that we treat in the hip region is avascular necrosis, and that's when part of the hip bone dies. In order to treat this, we actually drill a needle all the way down into the hip joint, into the bone itself, and we place the stem cells directly into the bone. As I mentioned, the same cells that can create new cartilage and create new ligament can also create new bone. So if you have an area of dead bone and you fill it with stem cells, it can heal that problem. So hip outcomes can be very good. Again, the right patient, 73% of Regenexx hip patients have returned to active sporting activities, which is extremely positive. This is an example of a needle going down into the bone itself. This is the needle going into the area of necrotic bone and delivering that up at the head of the femur, which is, this whole thing is the head of the femur. The other most common area that we treat is the spine. I have been treating spine problems for more than 25 years. Traditionally, I used to do just standard spinal injections like epidural steroid injections and nerve blocks and rhizotomies. However, we have switched, and now our practice is doing primarily regenerative procedures in the spine. So various conditions that we treat include things like irritated nerves or sciatica, painful and herniated disc, facet joint pain, ligament pain, spinal stenosis, sacroiliitis, and post-laminectomy syndrome. Post-laminectomy means people that have already had surgery. We treat a lot of people that have already had surgery in their spine. In the spine, we're doing mostly platelet procedures because platelets work better in the spine than stem cells. As I mentioned earlier, most of the injections I do now in the epidural space are done with platelets or platelet lysate and not with steroids. So this is just a X-ray guided picture of what a epidural injection looks like. And this is showing the difference between long-term outcome by using platelet lysate as opposed to using steroids. So if you use steroids, you may have an improvement early on, but by 3 months, that improvement's almost gone. And by 6 months, it's pretty much gone. Whereas if you inject platelet lysate, you can get significantly better long-term improvement. And again, that's what we're looking for. We're not just looking for a quick fix here. We're looking for long-term improvement. So we use platelets in the epidural space. We use it in the facet joints. We treat the ligaments. We treat the muscles. And when we're doing a spinal-based procedure, we're treating all of these at the same time, which leads to, again, a significantly better long-term outcome. So next, I'm going to talk a little bit about how Regenexx stacks up to other providers who are out there doing some of these procedures. And truthfully, a lot of these clinics have kind of gone by the wayside especially during the pandemic, because a lot of what they were doing was fraud and not based in science. Let's talk a little bit about some of this stuff. So a lot of clinics out there were doing amniotic stem cells. They're really not stem cells because it was the fluid was evaluated and it actually contained no stem cells. So this was basically a fraud procedure showing that it was mostly baby urine that was being injected into people, and people were calling it a stem cell procedure. There was no data to support this. And again, most of the clinics who have been doing amniotic fluid injections are now shut down because they couldn't survive because they had no results. Again, the pandemic came and it kind of separated out who the real clinics were and who the fake ones were. And most of these amniotic clinics have gone by the wayside because they're not injecting stem cells. And again, that's what the bottom of the slide is there to show. We are injecting undifferentiated stem cells that can actually make a difference when they're placed into the right area. Also, amniotic procedures are usually done in a chiropractor's office, not done by a physician, not done under guidance, meaning not using ultrasound or x-ray. They're just shoving needles in and hoping they hit the right spot. Often done by a PA or even a nurse. And often their costs are high or not higher than what we charge by doing similar procedures. The other type, again, the FDA also has been looking very hard at amniotic tissue, also looking at fat as a source for stem cells. There are a lot of people who are using fat as their main provider of stem cells. As I mentioned earlier, it is something that we have done and we can do, but we have gone away from it for two reasons. Number one, the FDA is cracking down on the use of fat as a source of stem cells, because in order to isolate stem cells from fat, you have to manipulate the fat to get the stem cells out, and the FDA has said you are now treating these as a drug, and therefore it is not FDA approved. Also, the other reason why we don't use fat as our source of stem cells is that there are 10 to 20 times more stem cells per volume in bone marrow than there are in fat. So why would we use an inferior product when we have a better product that, number one, is less painful to extract? And I know this because I've done a number of fat extractions. They're a lot more painful than doing a bone marrow extraction. And all of the research favors using bone marrow. So there has been a lot of different research going head to head between bone marrow and fat, and the research heavily favors bone marrow over fat as a source of our stem cells. So again, there's really no reason to be using fat as a source of stem cells when bone marrow is such a significantly better product. Again, are my stem cells too old? I've already answered this. The answer is no. Your body is constantly regenerating stem cells. So your stem cells are not the age that you are. And there's been no peer-based literature to show that stem cells are too old. And older patients, again, in our practice, have done extremely well. So the answer to this is just no. So what's the downside to all this? The downside to our procedures is that for the most part, insurance doesn't cover these. However, your insurance will cover a consultation in our office. So coming to see myself, to see Dr. Lieber, to see Dr. Sally in one of our 5 locations, we will do a comprehensive history and physical examination. We will review your diagnostic studies. That includes x-rays, MRIs, CAT scans, EMGs, or whatever other study you may have. If you don't have the right study, we'll order it and then we'll bring you back and go over it with you. That's all covered through insurance. Anything afterwards that we might order, such as physical therapy or bracing, that's all covered by insurance. What isn't covered is the actual procedure itself, the prolotherapy, the PRP, or the stem cell procedure. But again, what this is showing is that the average cost of knee surgery can be $30,000. And if you're looking at how much comes out of your pocket, lost wages, again, comparing it to a stem cell procedure, you are actually going to be paying a lot more money for orthopedic surgery than you would by doing a stem cell procedure. So again, depending on what we are recommending, the costs can be in different ranges. We will give you an honest opinion before you have to make any decision as to how much you want to spend. We will let you know whether or not you're a candidate and how much the cost would be involved with this. So in conclusion, Regenexx isn't magic pixie dust stem cells. These are real orthopedic, orthobiological cells that we're getting from you. We're placing them in the exact location. We're using interventional orthopedics to make sure we're doing this correctly. Regenexx has been doing this longer than anyone else in the United States. We publish more research and data than anybody else in the United States. We use our resources to constantly improve our product. I've been part of the Regenexx network for 9 years. Every year we're coming out with new and better things. It's very exciting to be on the cutting edge of regenerative medicine. And again, Regenexx is constantly looking at how we can make things better so we can make our outcomes better. Everything is all about improving how patients will do. So again, how do I get started? And the easiest answer is just come and see one of us in our offices. Again, that's myself, Dr. Lieber, Dr. Sally. We have office locations in Fox Chapel, in Sewickley, in Washington, PA, in Bridgeville, and in Monroeville. We can evaluate you in any of our offices and give you an honest opinion. Again, that is all covered through your insurance. And at the end of that discussion, you can talk about whether or not a regenerative procedure is something that you're interested in. We also do a lot of other things besides just regenerative procedures, so we may not even recommend that to you. If I feel you need surgery, I'll let you know. You need to go see a surgeon. This isn't something I can help you with. But again, that is how you get started, is just call our office, schedule an appointment, and I'll be happy to give you a comprehensive evaluation, as will Dr. Lieber, as will Dr. Sally, and we'll give you an honest opinion. So again, contact our call center at 412-963-6480. You can also go to our website at regenexpittsburgh.com and schedule a new patient evaluation. So that concludes my discussion, and I will stop sharing my screen and we can open up if there's any questions out there. So let me just so again, if anybody has a question, they can raise their hand. They can type it in. I believe I've unmuted everybody so people can just talk. And if not, I can address a few additional questions that commonly come up. So one question that I get asked probably most frequently is, all right, if this works, how long will it last? And that's and it's still an evolving question. Again, as I mentioned, we have been doing this for 9 years here in Pittsburgh, and we have now seen patients that are coming back more than 5 years after their procedure who are still doing very well. In addition, Regenexx has published data on 5-year outcomes. So we know that this isn't just a quick fix where it gets better for a while and then comes back to baseline. This is lasting for years and years and years, at least 5. We're hoping it's going to be more like 10 and maybe beyond that. So this is not just designed for a quick fix. It's not something that's just going to make you better for a year or 6 months or so. This is designed for long-term improvement. I see somebody has their hand raised. Janet?
Yes. Can you hear me?
I can hear you fine, yes.
Okay, I have already had a consultation in your Bridgeville office. I have arthritis in my hip, and I am 78 years old, relatively healthy. They have told me that there is a possibility that this is okay for me. However, you're telling me that the hip is at my age, and it is probably very much advanced to the point of bone on bone, like you discussed, that it is really not an option for me. As opposed to the surgery, which I am petrified of having the surgery.
You know, we need to make an individual decision. There's more that goes into it than just age and looking at an x-ray. So something that's really important is doing a comprehensive examination. So when we're examining you and really checking out how good you're moving, what your range of motion looks like, looking at some other factors. So, you know, when I say in general, older people with advanced arthritis don't do as well, yes, that's true, but that doesn't mean that an individual who's older and has advanced arthritis can't do well. So again, we certainly have done a number of patients your age who have advanced hip arthritis who have done well. But, you know, again, when you're comparing bigger numbers, that's what I'm kind of saying is they don't do as well. But that doesn't mean that, so again, don't leave tonight saying that, hey, I'm not a candidate. That needs to be discussed in the office, you know, in person, examining you, going over your x-rays and or MRI. And
okay, another question along that same line. If I would decide to have this, when you say you inject the stem cells into the hip area,
yes,
what happens to the arthritis? I mean, does that go away, or did the stem cells counteract the arthritis? Or
the stems, yeah, you're not gonna. Stem cells don't cure arthritis. Arthritis is a chronic degenerative condition. There is no cure for it. What a stem cells do 2 things for the joint. Number 1, and most importantly, is they change the microenvironment in the joint from a bad environment to a healthy environment, from one that's causing, you know, having degradatory enzymes to one that's causing proliferative or regenerating enzymes. So they're taking a toxic stew and making it a healthy stew. What does that mean? That means that a joint can move freer, it can hurt less. that's one thing that, and probably the most important thing that stem cells do. The other thing that stem cells do, as I mentioned earlier, is they can help to grow some new tissue. So it's going to help to grow, some cartilage back, some of the synovial fluid and other things within the joint. But it's not going to cure arthritis. So, again, there is no cure for arthritis, and we know that. The goal of a stem cell procedure is just to make an arthritic joint or another problem in a joint or area healthier and stronger. So certain, again, if a joint, there are some joints that can be too far gone that we can no longer treat. But again, that would be something that we would have to discuss with you,
So should I have another consultation?
I think it's absolutely worth coming back in and
do you
discussing.
Would you do x-rays of your own? Because for my consultation, I had to bring my own x-ray that
We
was
don't have
taken
that. I mean,
a month or so ago. So, it's not a current x-ray.
Sure, I'm sure we'd want to get new x-rays. We don't actually take them in the office, even though we have x-ray, but the x-ray we have is not diagnostic. It's just to help guide our needles in the right location. So we would order an x-ray, you would go get that done and bring it back to us. If you can get it done before the appointment, that would be great. So if your PCP would order x-rays for you, that would be great. You can bring that to the appointment, because I'm sure we would want to see current x-rays in order to help guide you and make a good, decision for you.
Okay, thank you.
Any other questions? One other thing that usually comes up is, can I do both my knees at the same time? Usually people that have knee arthritis have two bad knees, and it's not just one. And the answer to that is no. And the reason is because you can only get so many stem cells from one draw. And if you take half of those and put them in one knee and half and put them in the other knee, each knee is only getting a half a treatment. So what's better is you do one knee first, and then you will wait and bring the patient back, and usually about 6 months later, do the other knee. And the other thing that helps with doing it that way is that you get some time to do some rehab in between to help build up the strength and to make things more functional. So again, that's a common question that we get asked a lot. Looks like Michael has a question.
Yeah, how soon would you see the results, or would you feel the results after the injections?
Yeah, that's a great question. This is not a steroid shot, and I tell my patients that all the time, meaning that this is not a quick fix. We use the analogy of planting seeds in the garden. So I tell patients all the time, you can't plant seeds and have flowers the next day, meaning that this does take time. So on average, it's about a month before you start feeling any improvement. And it's really about 3 months when you're feeling like, wow, yeah, this is better. It's a big difference. And it's up to 6 months really before things peak. Now, that being said, this isn't something that is going to set you back at all. So, you're not going to be down, you're not going to be any worse. It just takes some time for the improvement to take place. It's also really important after the procedure that you do the correct exercise. So, 99% of our patients, we give a prescription to go to physical therapy, and we give specific instructions to take to a physical therapist about what type of exercises that you should be doing. So we try to stack the deck in your favor after a procedure to help make sure that that improvement comes, but it isn't a quick fix. So people who are looking for that, like steroid shot type of feel better the next day, it's not going to happen with a regenerative procedure. This is designed for long-term improvement. But again, just like a steroid shot makes you feel better right away, it goes away real quickly, and then it makes the joint worse. So this is kind of the opposite of a steroid shot. Are there any other questions? Any other comments?
I have a question.
Yes,
You did my knee about 5 or 6 years ago,
yes,
and I'm starting to have some problems with it again.
okay.
What's usually the protocol after that length of time? It did well for
Sure.
all those years.
Um, you know, obviously we would need to see you and take a look at it. And we have two options in that case. Number one is we can do a booster injection, which we do commonly for people who did well after a procedure and it's starting to wear off. A booster injection is done just with PRP or just with platelets. That's one option. If it is, kind of back to stage one, we could consider doing the whole procedure over again. As I mentioned, our technology today is a little better than it was 5 years ago because we're constantly innovating, and so we would have to evaluate you. We'd have to take a good look at what's going on. But oftentimes a booster shot works great. And that's less involved with just a PRP shot. So meaning it's just blood, spin it down. It's done on the same day. And usually for people who are starting to have feeling like things are wearing off and getting worse, the booster shot is done before we move on to doing a repeat stem cell procedure. As I mentioned, we've done close to 3,000 stem cell procedures in our practice. We've done less than 20 repeat on the same joints. So it's very rare to repeat a stem cell procedure in the same joint that we've already treated.
Thank you.
Sure.
I have one more question. Why doesn't insurance pay for it?
Well, that's a loaded question, and I wish I had the answer for it. The number one reason is because insurance doesn't like to pay for things. And if they can say no, they say no. So in other words, it never gets to physician review. If you call your insurance carrier and says, my doctor wants to do this procedure, we cover it, that secretary or administrator who answers the phone will look at a box and say, that's experimental, no. So in other words, they won't even review it. Now, I think things will eventually, they'll start considering this because we know that we have saved the insurance companies, thousands, if not millions of dollars by doing these procedures because people aren't going on to have surgery. So there are a lot of self-insured companies that are now covering Regenexx procedures because they recognize the fact that there's cost savings there. We're constantly collecting data, presenting data because we want these things to be covered by insurance. However, there's a lot that goes into what an insurance company covers. There's a lot of politics involved. There's a lot of deep pockets in the orthopedic community and the people who make artificial joints. There's lobbying, so that's why I said it's a very loaded question. I've been doing this now for 9 years. And unfortunately, when I first started, I said, oh, insurance will be covering this in a few years. Here we are 9 years later and they're still, for the most part, not covering it. So, I would hope that they will, see the light, smell the roses, but, and realize the cost savings. But unfortunately, that's not how insurance companies always do business.
I have another question.
Sure.
What is your typical procedure for neuropathy caused by arthritis in the spine?
If it's
pressure on the nerves.
Yeah, so pressure on the nerves in the spine, is primarily we're going to be doing platelet lysate into the epidural space. That's when I mentioned we lyse the platelets and release the healing enzymes right away. We also want to treat the ligaments that become hypertrophied and cause stenosis or narrowing of the space where the nerves travel through. So if we can make those ligaments tighter, so they're not narrowing the space, and at the same time treat those inflamed nerves, that's the best way of decreasing neuropathic pain coming from the spine. So it's a combination procedure just with platelets into ligaments into the epidural space at the same time. Okay. So are there any other questions before we sign off?
Thank you.
All right. Well, I thank everybody for sharing part of their evening with me tonight. And again, please come visit us in one of our offices. And I promise you, we'll give you an honest opinion, and you'll certainly leave knowing more about the problem that you have. And hope everybody has a good evening. And we look forward to seeing you. Thank you very much for joining me.
Thank you.
Thank you.